All right, guys, now let's get into the main parts of the brain. This is important. It's also mentioned in the neuro chapter. It's kind of a big highlight of the neuro chapter, and we actually talk about a little bit more there than we will here. But I want to hit the highlights with you now. So when you think about the cerebral hemispheres, there's 4 lobes as part of the cerebral hemispheres. And you guys know the first one, the frontal lobe, is going to be the largest. It's the most anterior portion, of course. And when you think about this, it's going to be dealing with motor, and in particular, the personality, planning, and production of speech. Patient's personality, their planning abilities, and production of speech. I put those 3 P's right next to each other. When you think about frontal lobe, that's what I would pay attention to. As you get into the next one, which is the parietal lobe, it's all about sensory. That's what you want to know about that. As you get into temporal lobe, I want you to think of the phrase like a temp, like temporary or temp, house worker. The H is going to be referring to the hippocampus, and the W is going to be Wernicke's. We'll talk about this more in neuro, but you want to know, again, the W, Wernicke's, you want to think wordy speech, right? That's kind of how you want to associate that. They don't know what they're saying a bunch of words, okay? Last but not least is the occipital lobe, and you want to know this is obviously where vision is going to transpire. So guys, now that we've finished looking at the main points of the lobes of the brain, let me show you how a more technical question was asked in the past test questions about this. So take a look at this and see what you think. Now I want to get into the portions of the diencephalon. And the big thing here you want to hone in on is the hypothalamus, okay? And I'm going to review this with you in neuro as well, but I want to draw this picture to reinforce it. When you think about the hypothalamus, first thing I would know right off the bat, guys, is that this has been hammered on old tests. And there's really 3 things you want to know about it, and it can be summarized by this picture of a car, okay? So I'm going to draw this picture here. And as you look at this, first thing I want you to pay attention to is how do you feed the car? And obviously it's through gas, and so you want to pay attention to the gas tank. This is going to be the fact that the hypothalamus moderates your hunger and your thirst. Now when you look at the front of the car, you're going to have the radiator, okay? And this is going to moderate the temperature regulation of the car, okay? And last but not least, imagine you're in this car, you're having this sweet ride, right? You park, you decided just to relax, it's a summer night, and you're sitting up looking through the sunroof and you're looking up into the stars and you're going to sleep, right? It's going to moderate your sleep patterns, in particular your circadian rhythms. That makes for a good test question. Pay attention to that. So those 3 things are what I would hone in on for the functions of the hypothalamus. So guys, now that we've finished looking at the main points of the lobes of the brain, let me show you how a more technical question was asked in the past test questions about this. So take a look at this and see what you think. Okay guys, the next one we want to talk about is the cerebellum. And let me show you how this was asked on a past test question. I just want to put you on the spot instead of just reading the notes. Take a look at this question and see what you'd pick. And just as a reminder, what cranial fossa is this located in? The posterior cranial fossa. Yes, okay. Pay attention to that as well. This has been hit multiple times on old test questions, those 2 facts, the function and the location. All right, guys, as you get into the brainstem, you guys know that the midbrain, pons, medulla make up the brainstem. You know this is where pretty much all of the cranial nerves are going to start their course, right? Except for 1 and 2, as it says there in your notes. But what I want you to look at is the box that talks about the rule of 4s, okay? Because if I were taking this test, to be honest, memorizing all these lists is kind of overwhelming. So what I would pay attention to is what cranial nerves start their course in the midbrain, the pons, and the medulla. And if you know that, for example, if you know the rule of 4 says 3 and 4, start in the midbrain, right? 5, 6, 7, 8, start in the pons. 9, 10, 11, 12, start in the medulla. See how there's a 4 and 3 and 4 for the midbrain. There's 4 cranial nerves. Pons, there's 4 cranial nerves that exit the medulla. And if they say something to me like a patient has a lesion in the midbrain, I'm going to know cranial nerves 3 and 4 are damaged. So then I'm going to ask myself, what does 3 do and what does 4 do? And if I can do that, then I can get the questions right. Now, it's a little bit more technical than that. I know there's more functions in that. But when you have a test like this with so many different sections, right, very difficult test, trying to memorize lists is going to be very difficult. So that's how I sort through it on a test. But what I'd really pay attention to is the medulla oblongata, okay? This makes for a good test question. When they've gotten really technical in terms of like exact functions, I would pay attention to the medulla. It's been mostly on this, okay? So when you look at the medulla oblongata, you can see the basic functions that you've known for years, right? Breathing, heart rate, autonomic type stuff. And take a look at this past test question to kind of make sure you got this down. I hope you're looking at these past test questions and thinking, wow, this isn't so bad. I can get every one of these questions right. You really can. We can get all of these 49. But as you look at this, one thing I want you to hone in on for like more higher level questions on the medulla, and I haven't seen a lot of these, but there's been a couple, so I want to prepare you in case they go a little further. Think of the Adam Sandler movie Waterboy, okay? Remember him? He was a high school football player. He was really like angry all the time. He had a lot of aggression. So when you think of medulla oblongata, it also deals with anger. It deals with that aggression, right? So think about that in blood pressure, right? So his blood pressure's up, he's all angry, and that's how you can picture the higher level functions. I don't mean like higher level, like harder, but like the harder type test questions that could come from the medulla oblongata. Last but not least, you're going to see in neuroscience almost all of the pathways like the trigeminal thalamic and spinal thalamic and all that stuff that you want to roll your eyes at me right now or throw things at the camera. Those all cross at the medulla. Almost every one of them does. So we're going to talk about that more in neuro. So I know you can't wait for that, but just kind of star that and say pathways cross here, because that's a general rule you want to take to the bank. All right, guys, when you get into nuclei of the brainstem, there's a few things here you want to hone in on that have been on past tests over and over again. And I'm going to draw this ridiculous picture here of a tongue. So take a look at this with me. When you look at this, if they ask you on boards what provides taste to the tongue, go ahead and take a second to kind of fill this out and see what you'd put if they ask that. So if they ask what provides taste to the front of the tongue, anterior 2/3, you're going to pick what? What are you going to put on there? Cranial nerve 7, yes. And you're going to do that through the chorda tympani nerve, which joins the lingual nerve, right? So it's going to be the lingual nerve that does that through the chorda tympani joining it, okay? Now, when you think about what also is going to do taste, you're going to think the back of the tongue is going to be done by cranial nerve 9, yes, good. Okay, you pay attention to that. Last but not least, so 7 and 9 are the fundamental things you should know. And by the way, when you look at that 9 right there, think 9, cranial nerve 9 is going to do stuff in the back of the throat. Not only taste in the back of the tongue, but also functions of the back of the throat, like swallowing, okay? Like the gag reflex, sensory for the gag reflex, okay? So think sensory way back there in the back of the throat, also swallowing, okay? That's big for 9. Last but not least, when you think of taste, you also want to remember there's one more cranial nerve that does taste. And by the way, this has been hit multiple times over and over again, this little subtle one, which is going to be cranial nerve 10. So let's put a little 10 right here. So when you think of taste, it's going to be 7, 9, and 10, which is going to do to the epiglottis region back here in the palate, okay? Now, when I look at this same picture, though, and I ask a different question, which is, which of the following cranial nerves does salivation? Not taste, but salivation. You want to know 7's going to do it again, okay? And 9 is going to do it, so 7 and 9. Now, what they've done on old test is they've gotten kind of technical on knowing what nuclei provide for that salivation. So when you think of 7, you want to think 7 is a superior cranial nerve. It's a big deal on this test. It's going to be all over the test. You want to think 7 superior salivatory nucleus. So 7 superior. Put that in your mind. 7 superior. That's what's going to provide salivation to that area, okay? Last but not least is 9. When you think of 9, think of it like you can only put up with, okay, 9 inferior parties a year, 9 bad parties a year. That's how you want to think of it. 9, cranial nerve 9 is going to use the inferior salivatory nucleus, right, to enter the parotid gland, all right? So that's how you have 9 inferior parties a year, or however you want to remember it, but they have gotten technical on that exact nucleus, so pay attention to that. So if I say taste, you want to think 7, 9, 10. If I say salivation, you want to think 7 and 9. Which one uses inferior? 9. Which one uses superior? 7. That's the big picture you want to get. I'm going to reinforce that a couple different ways in the next few pages, but that's been hammered on old tests and you'll be ready for it. All right, guys, now we're going to get into the blood supply of the brain. And by the way, you already know where I'm going with this, which is that we're going to get to the circle of Willis, and I'm going to ask you what 2 arteries make up the circle of Willis, and you're going to say the internal carotid artery and its branches, which we're going to hit in a second, and the vertebral artery, right, and its branches, which you already know what that is in a second. Vertebrals join to form the basilar. Basal gives off the posterior cerebral artery, blah, blah, blah. We'll get into it in a minute, okay? But the technical stuff they've been asking on this is go down in your notes to the internal carotid, and first of all, know where the internal carotid is created. In other words, where does the common carotid break into an internal and external carotid? That's been a test question multiple times, and you can see right there in your notes, it's at the superior border of the thyroid cartilage. Pay attention to that, highlight that. It says there, and you guys already know the course of the internal carotid. How does it get up into the skull? You're going to pick carotid canal. Yes, then it goes into the what? What cranial fossa? Middle cranial fossa. How does it get up into the middle cranial fossa? The foramen lacerum. Yes, right there. All that's in your notes. You're pounding that. Then it's going to go into the cavernous sinus, which we'll talk more in a second, right? And it has a cranial nerve right by its side, and you can add it right there if you want. I'm going to reinforce it in a few pages. What cranial nerve is right next to the internal carotid and the cavernous sinus? We haven't covered it yet, so if you already know this, you're like the man right now, or the woman, right? It's going to be cranial nerve 6. Yes, that's the big one you want to think is hugging the internal carotid in the cavernous sinus. Okay, it says there in your notes, it immediately gives off the ophthalmic artery to go to the eye. So any question in the eye about which provides blood supply, right, to any structure in the eye, it's going to be an ophthalmic artery branch. So when you want to think, how does the eye get all its blood supply, like the central retinal artery that you'll see in your notes, or the lacrimal artery, or any artery in the eye, you always want to know it comes off the ophthalmic artery, which is a branch of what? The internal carotid artery. Yes, okay, that's the big picture on what you want to know about that. Now, when I think about the internal carotid, though, I go to this visual in my mind, and I'm going to draw out the circle of Willis with you guys now, okay? So when you think of the internal carotid, it's going to have 4 branches, and those 4 branches are going to be OPAM. OPAM. You already know what the O is, which is the ophthalmic artery, right? Don't worry about that on this visual. Not important for your test. I would know there's 4 branches, OPAM. The ones that are important are the ones that contribute to this circle of Willis, baby. So look at this with me. The internal carotid gives off this branch right here called the posterior communicating artery, okay? You guys know that's going to link up with a branch from the basilar artery, which is going to be the posterior cerebral artery. So as we make this whole circle, you're going to see the internal carotid also gives off up here an anterior cerebral, right? And it forms that circle. So when you think of the circle of Willis, you can kind of glance at your notes to see the summary. But bottom line is, it is all about the internal carotid and its branches, which are OPAM. The P is going to be, again, posterior communicating. The A is anterior cerebral. The M is middle cerebral. OPAM are the branches of the internal carotid artery. Makes for a great test question. Sometimes it's just which of the following are branches of the internal carotid, and they try and mix up communicatings and cerebrals. Remember, it's only one communicating, that posterior communicating, the rest are cerebrals for the internal carotid artery. That's the key things I would pay attention to as you kind of figure out the circle Willis. We're going to talk about, by the way, later on in the notes, just briefly, where the vertebral arteries come from on the right and left side of the body, right? And you're going to need to know that, and we'll point that out toward the end of this lecture. I'll draw that out for you, okay? All right, guys, the next heading we're going to hit is the dura mater. Okay, this is not high yield, not hugely important, to be honest. I'm going to tell you what is important about it is what I'm going to tell you in like probably a minute and a half, which is where all this stuff drains to. And the technicalities of that have been hammered and have been a little difficult, to be honest. But I'm going to show you how they've asked that. I have a good visual here in a minute to kind of summarize it all very quickly. But the big thing I want to point out right here is the dura mater, it means tough mother. And there's a periosteum to it, an outer portion. Don't really worry about that. And an inner portion called the meningeal portion. And that meningeal portion has like folds in it, right? They kind of go into the brain and partition the brain a little bit and provide some protection, but also allow for that fluid to drain into the brain, okay? Now, as you look at these, you're going to see a couple Fowlkes words. If you haven't seen these in a while, Fowlkes means separate. So as you look in your notes here, Fowlkes cerebri is going to separate the right and left cerebral hemispheres. The other one that's easy is Fowlkes cerebelli. This is going to separate the cerebellar hemispheres, okay? Now, you can pay attention to those details if you want as you're looking at it, but again, what I would pay attention to is on the next page, the sinuses, okay? Now, if you look at this visual with me, some of you guys I know are going to be more visual, you just want to look at the visual. So pay attention to this visual right here, and you guys can see the Fowlkes cerebri right here in your notes, has the superior and inferior sagittal sinuses, the straight sinus, blah, blah, blah. The big thing I would know is those sinuses are going to come together as the confluence of sinuses. Everybody see that in the diagram? I want to take an arrow from right here and point it right here into the sigmoid sinus. So say this to yourself, all roads lead to the sigmoid sinus. All roads lead to the sigmoid sinus. Look in the same visual, the cavernous sinus is also going to the sigmoid sinus, right? And they want you to know that, and they want you to know that the sigmoid sinus becomes something. And as you can see right here in your diagram, it becomes the internal jugular vein. So say that sigmoid becomes the internal jugular vein. But as you guys look at this visual, the sigmoid sinus is by far the hottest item to be hit, but also pay attention to the pterygoid plexus, right? In the cavernous sinus, pterygoid plexus, sigmoid sinus, Those things are important in how they connect to one another, okay? They've kind of drilled this in multiple different ways. You can also see there that the superior and inferior ophthalmic veins are going directly into the cavernous sinus, right? That's important because all the blood in the eye is going straight from the eye to the cavernous sinus via the ophthalmic vein. Let me show you how these topics have been hit on past tests. While it's true that all roads lead to the sigmoid sinus, the one that keeps getting hammered on old tests even more frequently than that is the cavernous sinus. You want to know like this, like the back of your hand, know it really, really well. You might remember earlier in the video I said that the cavernous sinus, the border of it anteriorly is going to be what? The superior orbital fissure. Yes, that's where it starts there and extends back, right, all the way, as it says in your notes, into the petrous ridge of the temporal bone. Remember, we keep going back to that petrous ridge. That could be hopefully a kind of a clear boundary in your mind on the cavernous sinus. And as you know, it kind of extends around the body of the sphenoid. As you guys know, what sits in the body of the sphenoid bone? The pituitary gland. What's above the pituitary gland? The nasal fibers of the retina. Good, they cross there, right? So that's big, pay attention to that. And not only the location of the cavernous sinus, but also the contents of the cavernous sinus keep getting hit over and over again. And there's some great test questions here that you'll dominate on the test. You already know that when it comes to contents of the cavernous sinus, I want you to say it like this: 3, 4, 6, V1, V2. 3, 4, 6, V1, V2. And one little kind of rhyme I add to that in my mind to remind myself of what doesn't go through that makes for good test questions is I always say 3, 4, 6, V1, V2, V3, and 7 do not go through. 3, 4, 6, V1, V2, V3, and 7 do not go through. That's key because sometimes they'll say a patient has a lesion in the cavernous sinus. Which of the following would you expect? And you're going to go through and just nail 3, 4, and kind of talk about its functions and work backwards that way. That's how you answer a question like that. But sometimes they'll talk about stuff with the mandible and mastication and things like that. And you'll say, no, I already know V3 does not go through. So that's an easy question for me. When you look at the contents of it, pay attention to the fact that almost all of those go through the wall of the cavernous sinus. But there's something that goes through right of the gut, right in the middle of the cavernous sinus, and that's going to be the internal carotid artery. And what cranial nerve did we say hugs that? Take a look at this past test question to see if you're ready for this. Okay guys, we're going to get into scalp now, and this is our last section before we get into the cranial nerves, which is huge. That's the biggest thing by far that we want to pay attention to for the test. We've got to nail that. So this is going to be easy. So look at this visual with me on the scalp. When you think of the scalp, we've got a great mnemonic here that just spells scalp, S-C-A-L-P. The S, the C, and the A, there's only going to be 2 points I mentioned here. This is the first one. The S, the C, and the A are fused together. That's been on old tests, so pay attention to that. The other thing they've asked several times is which one of these layers out of the SCALP, which one of those 5 has blood vessels in it, okay? So it has lots of vascularization, and that's going to be the C, the connective tissue. So pay attention to that, star that, be ready to nail that on the test.